or hip bone. One hip bone, two makes hip girdle, and when I add sacrum, it will make a pelvis, bony pelvis. Good? Now, how to hold the hip bone? You know the technique. This is the right side bone, this is the left side bone. You know, put your hand in the greater sciatic notch, keeping all ilium up, acetabulum on the lateral side, pelvic cavity or pelvic surface inside, you will find the side of the bone. Sometimes very difficult in exams to find the right or left. Half because of less technique, half because of nervousness. So, be comfortable. So this is how it is found in anatomical position. It has ilium, it has pubis, it has ischium. What are the parts of ilium? Ilium has an iliac crest. Good. Iliac crest has an inner lip and outer lip. The highest point corresponds with L3 and L4 vertebra. Then it has anterior border, anterior superior iliac spine, a small depression. Anterior inferior iliac spine, then it will lead to acetabulum. On the back, the posterior superior iliac spine, a small depression, no name. Then posterior inferior iliac spine, then greater sciatic notch, then ischial spine separating greater from the lesser sciatic notch, then it will lead to ischial tuberosity. Good? Medial border is here. What are the medial border items? It is the medial border separating pelvic or iliac surface from sacropelvic surface. This is iliac fossa, this is sacropelvic surface. This is the border. The border will lead to this elevation, iliopubic eminence, and will continue to the superior border of ramus and tip of the ramus or the apex or the highest part, making all this line as pelvic inlet. Good? Then we have this body of the pubis with two rami, one here, one down.
Inferior.
Superior ramus, inferior ramus. Then we have important areas of this pubis is the pubic tubercle for inguinal ligament. Then it has a pecten, it has this elevated superior border. Then it has an inferior ramus which is not isolated, is joining one ramus from the ischium. So this is called as ischiopubic ramus. Then we have a pubic bone, ischium bone, which has a tuberosity, which has a spine, which has some pelvic surface, and all with this there is a ramus, small part, which is attached to the ramus of inferior ramus of the pubis, making a conjoined iliopubic ramus. Ischiopubic ramus. Here is obturator foramen. Obturator foramen is large and oval in males, small and may behave like triangular in females because of broadness of the pelvis. Then this is what is called acetabulum. It is deep enough, but still to make it deeper there is a fibrillar cartilaginous ring on it. You can appreciate a depression here which is empty, and to make it a bridge like there is a transverse acetabular ligament to hold, to make it more circular. There is a small gap in between, bridge. From that you will find, when we will read the head of the femur, you will find the contents moving in. The C shape is only articular, that it makes joint with the head of the femur. The remaining depression is fossa. It has a small amount of fat for more stabilization. Thank you very much.
Thank you.
I hope